everyone, and welcome back to Clinical Research and Tea with Jet. Today we're breaking down one of the biggest topics in medicine right now, GLP-1 medications for weight loss. You may have heard of names like Ozempic, Wegovy, and Trulicity. But what are these drugs? How do they work? And what are the risks? Let's talk about it. Nearly 40% of adults worldwide are overweight, and 13% are obese. Obesity isn't just about appearance. It increases the risks of cardiovascular disease, type 2 diabetes, dyslipidemia, metabolic syndrome, liver and kidney disease, high blood pressure, certain cancers, and premature death. Yet, weight loss can be difficult, and traditional methods like calorie restrictions often lead to rebound weight gain. Surgery works, but can be invasive. That's where GLP-1 medications come in. GLP-1 drugs, or glucagon-like peptide 1 receptor agonists, are medications that mimic a hormone your gut naturally produces after eating. This hormone triggers insulin release, slows digestion, lowers blood sugar, and increases feelings of fullness or satiety. Originally used for type 2 diabetes, GLP-1 medications like Ozempic and Wegovy and Victoza have shown powerful weight loss effects, even for people without diabetes. On average, they can help people lose 15 to 25% of their body weight in about a year. These drugs mimic the GLP-1 hormone and act on the pancreas to release more insulin, liver to reduce glucose production, stomach to slow down emptying, and brain to reduce hunger. They're not a cure on their own. You still need dietary changes, exercise, and lifestyle adjustments. Some newer drugs like Mounjaro target both GLP-1 and GIP receptors for potentially even greater effects. While GLP-1 drugs are promising, they do come with risks. Some common side effects are nausea and vomiting, diarrhea, loss of appetite, injection site irritation. Less common but serious effects are pancreatitis, gallbladder disease, acute kidney injury, and possible increased risk of medullary thyroid cancer. They also carry a box warning for people with personal or family history of certain thyroid cancers. Use during pregnancy is not safe. One of the biggest drawbacks, when you stop taking the medication, many people regain the weight they lost. That's why a long-term plan is essential. Weaning off medication gradually and maintaining new habits can help avoid rebound effects. The FDA currently approves GLP-1 drugs like semaglutide and liraglutide for people with a BMI of 30 or higher with obesity, a BMI of 27 or higher with comorbidity conditions like hypertension or diabetes. Always speak to a healthcare provider. These medications are not for everyone and work best when combined with the holistic care. Recent studies suggest that GLP-1 drugs like Wegovy and Ozempic may help prevent certain cancers and reduce the recurrence of cancers in patients. Research at the Case Western Reserve University analyzed data from about 34,000 obese individuals over a 15-year period and found a 19% decrease in obesity-related cancers, including breast, bowel, and liver cancers. Notably, the most significant findings were linked to colorectal cancer. In 2 comparative studies, patients treated with the GLP-1 drugs experienced a 44% lower incidence of colorectal cancer compared to those treated with insulin, and a 25% lower incidence compared to those treated with metformin. GLP-1 drugs are changing the way we manage obesity and diabetes. But they aren't magic. They're tools, and tools are only as good as how you use them. If you learned anything new today, hit that like button, subscribe, and drop your questions in the comments. Have you or someone you know tried GLP-1 meds? I'd love to hear your experience. Thanks for sipping some science with me on Clinical Research and Tea with Jet. I'll see you in the next video where we can have a cup of tea together.